Welcome, Namaste, and welcome to Dr. Shah's Clinic. Today's video, we're going to discuss on delay sprays, when to use and when not to. Now, delay sprays are used in the treatment of premature ejaculation. In premature ejaculation, men usually ejaculate within a minute, and this ejaculation can happen either before penetrating the partner or even during foreplay. Fundamentally, what happens is in men who have PME, their partners are exceedingly dissatisfied with sexual intercourse, they never achieve their orgasm, and because of that, numerous misunderstandings can happen in the relationship, sometimes even leading to the point of separation and divorce. PME affects almost 40% of the male population, and it's a really very common problem. It has to be treated. The problem with delay sprays is that number one, it does not treat the underlying cause of the premature ejaculation. Say the man has premature ejaculation because of the sensitivity at the tip of the organ. So you have the penis, and if the tip is sensitive, the delay spray can reduce the sensitivity for that particular sexual intercourse session. And why? Because these delay sprays contain anesthetic agents like lidocaine and prodocaine. You have to apply it 45 minutes before intercourse, and for that particular session, you may have a delay of maybe a minute or two, or maybe 3 minutes max. The next time when you have intercourse, again you have to use the spray. So how long can you practically, use this as a treatment option? So these delay sprays, invariably what happens is you'll end up using them for 5 years, 6 years, 7 years, 10 years. But your premature ejaculation is not going to get resolved or treated because the underlying cause is not corrected. On men who have PME, the latency time, which is cerebrally mediated, ejaculation is a cerebrally mediated event, is not corrected. Now, the latency time can be corrected in the brain only and only by taking medications for premature ejaculation. Delay sprays do not correct the latency time cerebrally, so you have to use it. So, long-term usage. Second problem with delay spray is that it also affects erection. Now, because the penis tip becomes less sensitive, the erectile function also can go down. So we have seen many patients who use delay spray and they complain of losing their erectile function and losing their mood during intercourse. So the ejaculation may be slightly delayed, but they will lose their erection and fundamentally they cannot perform. The third problem we have seen with some delay sprays, remember some of them, is that transference. The anesthetic agent will also come in contact with the vagina, and the female partner may have some degree of vaginal numbness. And because of the vaginal numbness, that will also to some extent interfere with her arousal and her sexual satisfaction. So these are the issues with delay sprays. So when can you use delay sprays? Now you can use delay sprays as a short-term treatment option. Say for example, you have noticed PME, and say if you're in a casual, you're someone who's very casual about sexual intercourse. Not the best way to be, but you're very casual about it. And you just want to, for that particular night or for that particular partner or just for that time you want to really prolong, then you can use a delay spray. But in the long run, it technically doesn't pan out anyway. So the best treatment option for delay spray, is basically no treatment with delay spray at all. Go with the medical therapy for premature ejaculation. There are a lot of drugs, there are a lot of medications which have very minimal side effects or no side effects, and they also give you better long-term treatment success. And in the long term, you can discontinue the premature ejaculation medication. Hope you like the video. Please like, comment, and subscribe. I'll see you soon with another video. This is Dr. Shah signing off for now. Welcome.